Nurses and midwives are the bedrock of all health systems. Without them, we cannot achieve universal health coverage and the Sustainable Development Goals. Nurses and midwives prevent people from getting sick. They help women and newborns to thrive, and they get people back on their feet and back to work.
Famous for being the lady with a lamp who organized the nursing of sick and wounded soldiers during the Crimean War, Florence Nightingale's far-sighted ideas and reforms have influenced the very nature of modern healthcare. Her greatest achievement was to transform nursing into a respectable profession for women, and in 1860 she established the first professional training school for nurses, the Nightingale Training School at St. Thomas Hospital. In East, Central and Southern Africa, a professional body was established in 1990 in Malawi to drive the key agenda of improving the standards of nursing and midwifery in the region. Popularly known by its acronym ECSACON, the East, Central and Southern Africa College of Nursing has risen to become a coordinating forum and mouthpiece for nursing and midwifery.
So when you're asked about a change in healthcare, we still have to maintain, certainly for nurses and midwives, a holistic patient care. Otherwise, we will be at nothing for the patient.
What we have to look at is the roles we have on the whole healthcare team and look at how that healthcare team is working together. It's really important right now that we aren't just talking to ourselves, that we're talking to our physician colleagues, that we're talking to our other colleagues, but we're seen as an equal on that healthcare team.
This is a college for both young and the old. And it's the only college in the region that would move the agenda of the UHC in the region through our united authoritative voice in matters to do with health.
ECSACON advises the ECSA-HC, which comprises health ministries in the region on matters relating to the profession.
The global community adopted the 13th Global Program of Work of WHO, among which are strategies and targets for the 3 billion. And we have undertaken as the global community to have 1 more billion people covered by universal health coverage. We have undertaken to protect 1 billion more people from the ravages of health emergencies.
The target of 1 billion more people benefiting from universal health coverage access to quality means access to quality, essential health services. And I emphasize those words given some of the points we've heard today. Yes, without financial hardship. It means leaving no one behind.
Nurses and midwives are providers of critical services in the health sector. They are there to ensure that all children under 5 years are fully immunized and that mothers deliver safely in our hospitals. In recognition of the important role they play in health, Her Excellency the First Lady launched a global campaign called Nursing Now. This campaign, supported by WHO, ICN, and UN, aims to raise the profile and status of nursing profession worldwide.
The progress we have already reached is evidence that we can and we must do more to reach our goal.
The nurses have asked for a table in the decision making. So that I take as a personal challenge that I'm going to ensure that as a county and as the chair of CECs for Health, we will have this conversation that we put nurses in the middle of decision making in the counties.
We are the lions of this kingdom.
The exotic Safari Park Hotel in Nairobi, Kenya, provided the venue for the 6th quadrennial meeting and the 13th ECSACON Scientific Conference from 5th to 7th September 2018. The scientific conference was preceded by 2 pre-conference meetings on 3rd and 4th September 2018, which addressed the issues of helping babies survive and human resources for health, supported by American Academy of Pediatrics, Dahl Global Health, and World Bank and International Finance Corporation, respectively. The aim of these meetings is to promote strategic partnerships and professional collaboration in nursing and midwifery education, research and practice in the region.
I would like very much for the developing countries, and particularly low and middle income countries, to learn the mistakes that the high-income countries have made. I'm very conscious that we've made huge mistakes in the high-income countries. We put all our energies and all our money into tertiary care, hospital care, and we have neglected prevention, health promotion, early intervention, assessment, and that's not good. We cannot continue that. So what I would hope for, certainly for Africa, certainly for this region, is that they would develop new models of care that would be models that everybody can learn from for the future. But please, you develop your own models. Don't develop the models that are there already. Learn from the lessons.
The scientific conference provided a platform for the nurses and midwives to share knowledge, experience, research findings, and to foster networks and linkages that help to strengthen their professional base.
The investment we make in nurses and midwives has a bigger payoff than investing in obstetrics. So investing in obstetrics is okay, but it's very expensive. So, and it costs to the tune of $4,000, whereas investing in midwives and nurses costs $2,000, and you get a bigger impact in terms. So this is really just justification of why we need to focus and invest in nursing care and midwifery care.
You're talking about nurses being undervalued, which I'll agree with you, but I'll disagree with you on the aspect of underutilized. Nurses are overutilized in our sub-Saharan Africa.
In October, we'll be looking more again at primary health care services, the review of the Alma Ata Declaration, and a big opportunity there. 12th of December every year is Universal Health Coverage Day. Make the very most of that. Have an event, do something, get something going and out there.
So I'm talking about a one-sided health system in the continent. One-sided. One-sided in the sense that we're investing more on curative than investing more on preventive. We're saying let's train more health workers. But the point is, those who are already employed, who is ensuring that they are motivated to work?
The quadrennial meeting is a decision-making forum where previous resolutions are reviewed and new ones are adopted and ratified. The theme for the 2018 meeting and conference was Nurses and Midwives Responding to the Global Agenda on Sustainable Development Goals and Universal Health Coverage. Pomp and pageantry marked the opening ceremony with delegates from 15 ECSA countries staging a colorful parade of nations.
Our chief guest, that is Botswana, walking in, clap for Lesotho. Clap for Malawi. You remind us our roots. The land of Dr. John Kapombe Magufuli. Swaziland, let's clap for Swaziland. Zambia. They're coming in style. Now the host country, Kenya, led by Kisumu City. We are here to Hakuna Matata. Hakuna Matata. Hakuna Matata.
The chief guest, Mrs. Rachel Shebesh, Chief Administrative Secretary in the Kenyan Ministry of Public Service, Youth and Gender, officially opened the conference on behalf of His Excellency Mr. William Ruto, Deputy President of the Republic of Kenya.
And today I'm very privileged and humbled to represent the Deputy President at this function and speak on his behalf. I will quickly say that I am amazed by the thoughts and the process that is going on in this conference to take nursing to another level. I am in 100% agreement. I am in agreement 100% that that is the way to go. And I also do realize and acknowledge the work that nurses do in this country. And so, Director of WHO, President of ECSACON, President of the International Council of Nurses, Director General of ECSA, President and CEO of GPAGO, Director Nursing Programs, country representatives, delegates, distinguished guests, and I want to add the First Lady of Kisumu, Dorothy Nyong'o, who we are very proud of, and of course one of our trailblazers, Mrs. Kireni, who is sitting on the table here. Ladies and gentlemen, nurses and midwives, thank you for inviting me here today to open the 13th biennial ECSACON Scientific Conference and the 6th quadrennial meeting.
The main keynote speaker was Dr. Rudiger Kretsch, the Director for Universal Health Coverage and Health Systems at the World Health Organization.
Every country needs a competent, motivated, well-distributed and supported health workforce. Health workers are at the cornerstone of the strong, resilient health systems needed to achieve universal health coverage. And that is why
other keynote speakers delivered presentations based on 6 sub-themes.
What came out of the research that was done in the Triple Impact report was that many nurses across the globe, whether it was in England or it was in an African country or some other part of the world, nurses felt undervalued, underutilized, and were not able to work to the top of their level of competence. Now, I think you will recognize what I'm talking about. Nurses are now highly trained, highly educated. We need to make sure that is put into practice.
In Kenya, for instance, the health agenda is one of the 4 agendas for the president in this country. And we can testify in most of our countries, we are seeing more political commitment. But what is important for us, how do we utilize this opportunity to develop and further to achieve our maximum contribution as nurses and midwives?
And the need really is for us to invest in education, in the jobs creation for nurses and for midwives. And this is going to improve the outcomes in health, global health security, and also span economic growth.
Breakaway sessions were held to discuss over 130 presentations.
The world is full of promises, as you all know. And right now we have so many promises on health, which if we achieved, we would definitely achieve universal health coverage in Africa.
Where is the voice of the client? Where is the voice of the health worker? Where is the voice of the policymaker? And how do we bridge the 3 of them to ensure at the end of the day, we provide quality health care?
We cannot talk about UHCs, achieving UHCs, when there is nobody who is preparing nurses and midwives for demographic transitions in Africa.
Therefore, training of human resource is also donor-dependent, not sustainable. Right now, all our training are being funded. AMREF is one of our biggest funder also. UNAPA through Canadian funds, and Sweden, I think to mention, that is what is happening. Without them, we'll close the schools.
From an education point of view, the definition of education is that people acquire knowledge and skills. and they should change their values and attitudes. The problem we are having is attitude. And therefore, if we look at the education systems we have for nurses and midwifery in our respective countries, it will do us a lot to change their attitudes.
For us to really achieve universal health coverage, AMREF is saying we need to be accountable to our actions as nurses and midwives.
What I saw was a clear illustration of supporting people that were available to create a team and to manage that team in order to support that team, to be able to get the most out of that team, make sure that they had the competencies and that they had the accountability for the care that they were being asked to provide.
The delegates had an opportunity to sample the finest Kenyan cuisines as they enjoyed tantalizing entertainment from the famous Safari Cart troupe. Various organizations and agencies partnered with the ECSACON Secretariat to sponsor the event. Key among them were the Kenyan Ministry of Health, JAPIEGO, IPAS, UNFPA, USAID, PEPFAR, Kenya Airways, World Bank AMREF, Nursing Council of Kenya, LERDAL, among others. After the conference, the quadrennial meeting took place where key resolutions were discussed and proposed.
Colleagues, this is an opportunity for us to examine ourselves and look back at the history of our profession.
If you don't communicate, you don't know what you are doing, you don't know where you are going. So that one legacy I've left behind. We are now talking, we are communicating, and we are discussing issues that are going to move the college ahead.
Increasing the number of women who are actually attending NC4 has increased both in Nigeria and in Kenya, where we were conducting the study. And 9 out of 10 of the women had at least attended the 4th NC. And also it increased facility-based deliveries, because that's where we want the women to go. We want them to deliver in facilities, and that's what we have seen.
The other recommendation was that can we have policies that fully support pregnant women, so that at 22 weeks they are now asked to do light duties, so that all the industry workplaces know that a pregnant woman should be given light work and they should go on maternity early.
If we manage well mothers at the peripheral facilities, we may reduce the complications, and also the outcomes will be good, alive mothers and babies.
We realized that by engaging a youth peer provider in those facilities, the young people felt safe and they were able to discuss their sexual reproductive health needs at the corners that were given unto them, and they were able to now be linked with the provider for that prompt service uptake.
70% of all pregnancies in Kenya are within the age of 10 to 24 years. They cannot access family planning. One, because we shall tell them they are children, we shall not give them. Secondly, when they get pregnant, we don't want to overservice. So it's a critical issue. We have talked with the Nursing Council, and we want to look at the scope of practice for midwives and the nurses who provide reproductive health, so that we are able to expand that scope.
So we can imagine the impact this is creating by young people taking up effective methods of contraception. 60% of our clients are below the age of 24, and 45% are below the age of 19 for abortion care services. We also trained providers, and we did specifically values clarification and attitude transformation. As I said, we found a very stigmatized service. There was a lot of stigma associated with abortion, and one of the first things we had to do was really clarify values.
I come from a community that practices FGM, so as a nurse,
I've realized it's time to speak about it. It's time to speak up about the negative effects of it. And it's time to talk about the no to medicalization of FGM, which some of my medical personnel think it is right, and I feel it cannot be and it can't work.
So that all the hospitals could have facilities where they cater for these physical challenged women. They cannot use their own wheelchair to enter the hospital. They need somebody. There are no ramps, there are no rails. So it is very, very important that each hospital should actually make it easy for them to access the reproductive health services without any assistance, so that at least they maintain their privacy.
When you implement the standard-based management and recognition, it is a simple approach, it is cost-effective, and once the healthcare workers understand the concept, they are able to apply the standard-based management approach in improving quality of care. Because this approach, one thing is that the gaps are identified, and when the gaps are identified, you come up with the causes. And normally we encourage the healthcare workers to use the low-hanging fruits to actually address the gaps.
Kenya has set quite a bar, and a high bar in the region. And we are hoping that we're going to sustain, we're going to maintain, we're going to be more innovative, more creative. First of all, to be visible in the country and to keep our members informed of what is going on. And secondly, we are also going to influence the strengthening of the systems at the Secretariat on issues that have been identified, being the weak points. And then thirdly is to strengthen the faculties, because the vision of the college is excellence. It's excellence.
I respect, I suppose, nurses now more than I ever did in my life, because I've seen what challenges, and particularly here now at the ECSACON Conference, what challenges you face in Africa and the challenges you meet every day, and meet with a smile. I've been really encouraged by the way that I have spoken to the different countries, the nurses of the different countries, and absolutely amazed at how they meet the demands, particularly in some countries like South Sudan. I am just at loss of words to say how they can continue in a world that's in unrest, in civil war, and with very few resources and very few nurses, and not even being paid at times.
A new team was elected to take the college forward for the next 4 years.
My name is Kwagase Khwabi. I come from Botswana. I'm contesting for the position of presidency.
I am Dr. Ruth Mkonda, a lecturer at the University of Swaziland. I believe I am qualified to lead the prestigious College of Nursing.
Thank you very much, the candidates. I hope whoever wins will promote kangaroo fatherhood.
The voting exercise was very democratic, and it was administered by the Kenya Independent Electoral and Boundaries Commission.
Ruth? Kyogase? Ruth?
Outgoing President Susan Otieno expressed her satisfaction at the performance of the college.
Nurses and midwives have worked towards strengthening nursing and midwifery practices. It is now time we want to shift focus to train our nurses, especially on the specialty area, to meet the gaps that are existing in our region. Let me conclude by thanking nurses in this region for the support they accorded me during my term as the president during the last 4 years. I welcome the incoming president together with the new team, and I wish them the very best. Thank you so much.
The incoming president, Keynote Kwabi, exuded confidence in the future of the nursing fraternity in the region and indeed in the continent.
I've learned a lot of things in this ECSACON 2018. I've learned a lot of things because when we were together, that's when I realized that our constitution was having a lot of gray areas. And I'm really going to try my best to try and review the the Constitution.
As the curtains fell on the 2018 ECSACON Conference, it is the hope of the college that the event will play a major role in enhancing the practice of nursing and midwifery towards attaining the global agenda on sustainable development goals and universal health coverage.